Welcome everyone to the February webinar, which is going to be all about heart health and some tips and tricks on how to keep our hearts healthy. My name is Jazzi, health fitness specialist with Exos at Autodesk. Really excited to be here with you all today. So, going to get started here. And what we're going to talk about first is going to be some heart disease, kind of like the background of it and some risk factors here. And then we're going to move into those heart healthy strategies. And then finally ending with some questions. So, if you have any questions at any point in time, you can either drop it in the chat or you can wait until the end, come off mute and ask away. So, first up, heart disease. So, what is heart disease? There's a kind of a few different aspects of heart disease. So one of them could be, narrowed or blocked blood vessels. So this is kind of what coronary artery disease is like. There's some buildup and some blockage from, saturated fats, things like that, some plaque buildup. So that's kind of one aspect of it. Another aspect is going to be some impact to heart muscle, valves, or rhythm. So this is kind of more related to heart arrhythmia, which is going to be either an increased or decreased heart rate. So if you've heard the medical terms like tachycardia or bradycardia, those are kind of those aspects of heart disease. And, it's very lucky that we can prevent heart disease through a healthy lifestyle. So that's kind of what we're going to be going into today. And first, before we get into all of that, kind of what are the factors that puts someone at risk for any type of heart disease? So this first one here, high blood cholesterol. So there are two types of cholesterol. You have your LDL cholesterol and your HDL cholesterol. So first one, the LDL, is low density lipoprotein, and this is what causes plaque buildup. So if you have a high amounts of LDL cholesterol or the bad cholesterol, then that's kind of where things like plaque buildup, heart attacks, all of that stems from too high of LDL. The HDL, which is the high density lipoprotein, these are going to be the quote unquote good cholesterol. And what happens is the HDL will absorb the cholesterol that is free floating through the body, and it will carry that back to the liver for us to digest it and expel that. So it helps lower our cholesterol by having higher amounts of HDL. So that's kind of the background with cholesterol. Up next, high blood pressure. So high blood pressure is going to be diagnosable through a blood pressure machine, which I know if you've come to us at Club 111 in the past, we do have that our high blood pressure, not heart rate, our blood pressure monitor that we bring out when we're tabling sometimes. And a normal blood pressure is going to be, so side note, back up here. When we're checking blood pressure, there's going to be two numbers. So the first one is a systolic, which is going to be the blood leaving, and then the diastolic is the blood coming back. So when you're listening, like when you have the doctor listening on your arm with a stethoscope, they're listening for a little pop between the two. And those two numbers are pretty important to determine if you have high blood pressure. So a normal blood pressure is going to be below 120 for that systolic and below 88. And this is all measured in milligrams of mercury, millimeters of mercury, which is pressure. And stage 1 hypertension is going to be between 130 and 139 for the first number, and between 80 and 89 for the second. And then stage 2 is anything over 140 and anything over 90. So those are just some numbers to kind of look at to see where we're at with blood pressure. Next thing here, uncontrolled diabetes. So, it's a lot easier nowadays to have, go to your doctor, get control of your diabetes with your insulin and everything. So making sure that if you do have diabetes, everything is under control, in check, and you're checking in with your doctor. Family history. If you have a family history of heart disease, high blood pressure, high cholesterol, high stress, things like that, that's going to definitely determine your risk factor. Smoking, definitely, we know at this point, right, smoking can be detrimental to our heart and put us more at risk for different diseases, just like, the heart arrhythmias and everything. Physical inactivity. The more we sit down, the less we're using our heart, the less our heart muscles are getting used, leads to heart disease. And finally, diet, leading back to that cholesterol, right? If you're eating foods high in cholesterol, sodium, things like that, that can put you more at risk if you have a poor diet and lifestyle choice. So that's why we're going to go ahead and talk about those heart health strategies and talk about what we can do with our diets to help prevent, and not just prevent, but to help us be healthier when it comes to our hearts and heart disease. So, first up, produce. Fruits and vegetables are so wonderful to be eating. We all know to eat our fruits and veggies, right? Sometimes it's harder to do that than others. I know fruit is sometimes a bit yummier than the vegetables, but if we aim to eat the rainbow when it comes to not Skittles, but when it comes to produce, that's going to be definitely the best way to get the most amount of benefits out of that. So each color of food has a different purpose. So, for example, red is going to help the heart and circulatory systems. So things like raspberries, apples, tomatoes, things like that are going to help. And then yellow for brain function. So yellow peppers, bananas, things like that. And another example is going to be orange. That's going to help with skin and mucosal tissues. So I know the carrots is going to help your eyesight. That's still mucosal tissue, right? So eating the most at every meal that we can is going to be very beneficial. Fruits and vegetables also do have fiber, and fiber is really important to help lower LDL cholesterol. So with fiber, what's going to happen is it's going to attach to the LDL cholesterol, and that's what's going to prevent it from entering the bloodstream. So that's how that kind of helps us. So the more fiber we have, the lower our LDL cholesterol is going to be. Lastly, all forms of produce do count. So this is a pro tip hack. If you go to the store and you buy, let's say we want to buy groceries for the week, but we're not going to eat everything, within the first few days. You stock up on some frozen green beans as well as some fresh green beans, maybe some canned green beans. That's going to last you a little bit longer, but they're all of them have nutrients, right? So you can definitely, when you're at the store, aim to get as much produce as you can. And if you're not going to eat it quick enough, you can always freeze it. You can buy frozen. I know I love doing that. So it's definitely an easy way to get more fruits and vegetables in. Up next, we have our whole grains. So whole grains are also high in fiber. And this is, again, fiber helps with the LDL cholesterol. We do want to aim to get 3 to 4 grams of fiber in all of our whole grain sources, our fruits and vegetables, things like that, aiming for about 25 to 30 grams of fiber per day to help with digestion as well as with that LDL cholesterol. And the difference between whole grains versus other carbohydrates or with processed forms of grains like white breads, the difference is that the whole grains have the endosperm, the germ, and the bran. And the bran aspect of whole grains is going to be the one that has the most fiber, as well as the most nutrients like B vitamins, iron, copper, zinc, magnesium, and other antioxidants. So that's why we want to aim to have more whole grains versus those processed forms of grains. And then this last bullet here, whole grains can help reduce the risk of stroke, diabetes, and even colorectal cancer. And this is because it does whole grains and fibers, it helps to prevent the formation of small blood clots. And blood clots are definitely huge factors of stroke and diabetes. So a lot of benefits here for whole grains. And then leading up into lean protein. So protein is a really important aspect of each meal that we should be having, and every meal we eat, we should be eating protein. It does help maintain muscle mass, and that even is going to include our cardiac muscle, right? Like our heart is a muscle, so we need to make sure we're maintaining that. And multiple processes of our bodies do use proteins. So our DNA, that's amino acids, that's protein. So it's really important to make sure we're keeping up our protein intake to help our bodies function optimally. We do want to choose lean sources of protein that are lower in saturated fat. So saturated fat are the molecules that they don't have any double bonds in the chain of the fatty acids. So that means they can just lay on top of each other, and that's how plaque buildup happens. So it's really important to make sure we're mixing up our protein sources and choosing sources that are going to be lower in saturated fat. And that's also going to be any plant-based sources. So plant-based sources of protein are going to be higher in fiber. So it's a great option to help, lower that cholesterol as well as lower that saturated fat. So eating some plant-based sources is really going to help round out our overall diets. And when we're focusing on building our plate, so like I said, really important to make sure we're getting one serving of a lean protein every time we eat. And if you look over to the infographic on the right hand side here, it has a bunch of different serving sizes that you can use based on looking at something. So about a serving of protein is going to be about your palm size or the size of a deck of cards. So we want to aim for about 3 to 4 ounces of that. And a couple examples are going to be things like turkey, like 99.1 turkey, even 93.7 turkey, pretty lower in fat. And salmon is another great option. The omega-3 fatty acids in salmon are also really great for you and brain health as well. So that's another great choice. And then also tofu. It's a plant-based source. It's going to have more fiber. It's made from, beans. So that's going to be another great option there. And then you want one serving of whole grains. So things like quinoa, oatmeal, farro. You can even have bread with that. Just any serving of whole grain. You want to think brown, close to the ground with whole grains. And then a serving of either fruit or vegetables. So, I gave a couple different examples of colors. So peppers, zucchini, beets. There's endless possibilities here with fruits and vegetables. So definitely have fun with that. And then lastly, one serving of fats. And so, going off the theme of staying low in saturated fats, want to make sure that we're getting plant-based sources. So things like olive oil, nuts, flaxseed oil is another great option. Flax seeds are high in omega-3s as well. So, just another way to get some more nutrients in and to switch up the oil that you are using. And lastly, here we have some lifestyle habits that we can incorporate that will help protect our hearts and increase our heart health. First thing first, sleep. I know it's hard sometimes to get a lot of sleep, but we really do want to aim between 7 and 9 hours every single night. Our bodies like routines. We want to aim to go to bed around the same time and wake up around the same time, regardless of if it's a weekend or a weekday. I know that's tough, but our bodies like that routine. Also, our bodies need at least 4 hours of sleep for our brain to recover and 4 hours for our body to recover. So really aiming for that 8 hours is going to be that sweet spot. Next up here, exercise. So we want to start small and increase to work up to that 150 minutes a week. It's going to be about moderate to vigorous exercise. So going for longer walks, maybe taking a class of ours, getting some training done. So there's a few different ways that you can get some exercise in, but movement is medicine. And, really making sure we're getting some exercise in, getting that heart rate going, get the blood flowing, and making sure that we're doing good things for our body. And then lastly here, kind of tying back with diet, but really making sure you're eating balanced meals throughout the day in the optimal amounts for you. So everyone is going to need a different amount of food to feel their best. So, kind of experiment, see what's going to be the best option there for you. All right. So any questions? I see we do have one in the chat box here. So do you have thoughts or advice on the percentages of macros for heart health? Like how should you divide the percentage of protein, fat, and carbs? So this is actually a great question. I know macronutrients are something that is really important. And when we're paying attention to what we're eating, sometimes, finding a right balance for ourselves is going to be something really important, but also something that will help us feel good and feel better. So generally for general health, which does include heart health, usually somewhere around 40% of protein, 40% carbs, and no, 35 protein, 35 carbs, and 25 fat. Something around there is going to be kind of the general recommendations in terms of, how much to with protein, making sure you're eating about anywhere between 0.8 to 1 to 1.2 grams of protein per pound of body weight or lean body mass that you have. I like to use a general rule of thumb. If you have a goal weight, that's the amount of protein in grams that you should be eating. And then the rest of your calories can come from fat and carbs. Really making sure we're getting high quality sources here is going to be the most important thing versus just how much, right? We want to make sure we're getting high quality nutrients out of our fat sources, like using olive oil instead of canola or vegetable oil, or, eating whole grain bread versus white bread, things like that. So hopefully that answers your question. Does anyone else have any other questions today about heart health about anything I went over, or food, fruits and vegetables, anything like that? All right. Would you recommend a form of meditation if someone is trying to lower their resting heart rate or take control of their heart rates? This is a great question. I love this. I know something that's a little bit newer here is going to be your heart rate variability, or how much your heart rate is going up and down throughout the day and night. And sometimes that can be a marker of your recovery from day to day. And I do think like any form of restorative yoga or meditation is going to be a great way to kind of get that heart rate lowered by using some breathing techniques. I know some people really like guided meditations. Personally, that makes me very anxious to have to like sit down and spend a certain amount of time that someone's talking at me. I like my heart rate doesn't get down any lower. So finding a form that works for you, whether that's going for a walk and just kind of like zoning out. I like to honestly lay on the ground with on my back with my eyes closed, listening to some birds chirping, and I just start slowing my breath down, focusing on my breath, and repeating a mantra that I like to have. So, um, you know, it's hard to recommend a form of meditation because everyone prefers something different. Just like nutrition and fitness, even meditation and mental health is going to be person dependent. So definitely recommend some deep breathing to make sure we're calming our bodies down and calming our heart rates down, getting into that parasympathetic nervous system state. So that way we can get that heart rate lowered and help our hearts out and not stress out our cardiac muscle there. Great questions. All right. Well, if no one else has any more questions, that's kind of all we have for you today. So thank you all so much for taking time out of your day to join me to learn about heart health, talk about all of this. It's a really fun topic. It's February. I don't know if anyone, when you were a kid, we used to do Jump for Heart in February. So I always, relate February to heart health. So if anyone has any questions after this, you can always, send us an email. You can find us on Slack, DM us on Teams, whatever is the easiest way to find us. But thank you all for coming. I hope you all have a great afternoon, and I'll hopefully talk to you all soon.
Thanks, Jazzy.
Thanks for coming.